Good morning, everyone. Hello, and a very warm welcome to the first session of Day 4 of the Faculty Development Program. Innovative research is the need of the hour today. So, with a relative sub theme that is innovative trends in research, let us begin with the proceedings. Without taking further time, let me introduce you all to our first resource person of the day, Professor Dr. Rajesh Nair ji. Director, Amity Institute of Behavioral and Allied Sciences, Amity University, Gurgaon. Dr. Nair is a PhD in health psychology and has taken public health training at Institute of Public Health and Primary Care, University of Cambridge, UK, master's with specialization in clinical and abnormal psychology. He has 21 years of work experience as he worked as a national consultant to provide technical support by UNDP, that is United Nations Development Program, at NACO. Along with such a vast experience, he is the state lead for the STEPS project, that is strengthening of tobacco control efforts through innovative partnerships and strategies, Gujarat. He is a true nation builder as he has worked as an associate professor and additional professor at Indian Institute of Public Health, Delhi from 2013 to 19 and has over 24 publications to his credit in the area of public health and health psychology. The topic of the session is research methodology, primarily focusing on the mixed method design. Over to you, sir. All yours.
Thank you, Anubhav, for this wonderful introduction. I would like to sincerely thank the senior management of Om Sterling Global University for organizing this wonderful opportunity to connect with so many research scholars, students, faculty, and many more people who work in the practice area of social behavioral sciences and many other areas. I also would like to thank Dr. Tanu Kukreja and Dr. Mukesh Yadav for helping me out to work on this presentation. And Anubhav, finally, thank you again for leading me to this discussion. Thank you so much. Now I should upload my presentation.
Yes, sir.
Just confirm, Anubhav, if it is visible.
Not yet, sir.
Not yet.
Not yet, sir.
Okay. Uh, should I do it again? 1 second. Yeah. I think it has come through now.
Yes, sir. It's visible now.
Okay. Okay. Right. Thank you so much for the introduction. So, the topic which has been assigned to me for this conclave is research methodology and specifically looking into mixed method research designs. And as Anubhav has detailed out some of my experiences in the field of health psychology and public health, so I would be taking you through with examples related to the field of health psychology and public health while discussing some of these designs. I would request the participants, if they have any question or comment, please use the comments box. And then at the end of the presentation, we will take all the questions one by one. So let's move to the presentation as such. If you look at the scope of this session, what I am trying to do is I have mentioned couple of sessions or subsessions in this whole presentation. I will take you through the mixed method research designs in the beginning so that a perspective about the entire discussion and the topic is made, why this mixing and how this mix has to take place, in the research design. We will talk about that. Specifically, I would mention with example by using precede proceed model to help us to understand at what level this mixing should take place. Though I would be referring some of the aspects related to qualitative research and quantitative research, but definitely we'll talk little more detail subsequently in the presentation. I'll talk about qualitative research and later the data analysis part of qualitative research. So question comes, why mixing the research designs, right? So to understand that, we need to understand first what is mixed method designs. I'm sure many of you who have been teaching would know about the mixed method design per se. So mixed method research is a methodology for conducting research that involves collecting, analyzing, and integrating or mixing the quantitative and qualitative research data in a single study or a longitudinal program of inquiry. This is a standard definition of mixed method research designs. Now, what we are trying to do here is we are collecting the data, both quantitative and qualitative, and trying to see that if there is a complementarity between the information which we have gathered. Triangulation of data always helps because it helps us in planning an intervention. Let's say in case of public health or psychological interventions, we not only require the quantitative information, but we desperately need the qualitative information as well, because the changes which we would want to see over a period of time have to be seen in qualitative as well. Means where scale is important in terms of the reach of the intervention, it is also important that how the acceptability trust part of the intervention is also taking place, right? So all kind of psychosocial, behavioral, social interventions, public health interventions would require data both qualitative and quantitative in nature. Now, why mixing? Of course, by having both quantitative and qualitative data, we can corroborate information which would improve the validity of the data which we get. Also, it helps in terms of developing the indicators, the baseline indicators, which we can compare with the inline data or survey, and we can see what kind of success indicators have been achieved after the completion of that intervention. So the validity of information which is gathered improves upon. And we know that both quantitative and qualitative data research methods have their own weaknesses. So, in a way, by having both the research methodology in place in any survey or any study would improve upon the quality of the information, the quality of that particular research, the quality of that intervention. In terms of completeness, as I said, both quantitative data and qualitative data are complementary in nature, right? So, some information, if we are not able to get through quantitative mode, it is much more easier that we get it from qualitative information. I'll talk about what exactly I'm referring to. So, in terms of completeness, having mixed method is more comprehensive and more detailed information which is required for any intervention. In terms of processes, quantitative provides outcomes and qualitative the processes. Basically, quantitative helps us in terms of looking at uh, where we would want to reach after, say, 2 years, 3 years, or 5 years of intervention. Whereas qualitative informs us the processes through which we have to lead the intervention. It helps us in terms of improving the monitoring aspect. It helps us in terms of the gains, the misses, so that any point in time of that intervention, we are able to take corrective measures. explanation. In terms of explanation, qualitative can explain quantitative results or vice versa, because while some of the answers you may not have while you do only quantitative research methodology. So it is important that we have both quantitative and qualitative information, because they also inform each other's data. Surprising results from one can help in terms of explaining the other result as well. Qualitative employed to design the instrument. In many a times, I'll talk about in the designs, when you are not very much clear about the variables, the tools which have to be used for the research, it is important that qualitative study is done first to understand the variables, to understand how much the scale of that intervention, to understand the population, to understand the sample size, the characteristics of sample. So qualitative research data can proceed the quantitative research data collection. In terms of credibility, both approaches enhances the integrity of findings, and more researches are getting accepted when they are based on mixed method research design. As I said, for any kind of intervention where we have to plan, let's say, some targeted or focused intervention, it is very important that we understand the context. So, qualitative research methods provide us that context, whereas quantitative data would provide us the scale of that intervention. It helps us in terms of measuring the outcome, or maybe impact. But qualitative helps us in terms of gaining the information, are we on right path of that intervention or not. In terms of utility, most useful for practitioners and policymakers. So if you look at the kind of studies which are mostly accepted by the policymakers, decision maker, it is mostly around mixed method research designs, because based on that they would be able to make their guidelines, they can develop some kind of policies, and of course some structural changes, if at all, has to be made. It is based on both qualitative and quantitative information. So mixed method research designs have its own value. Now, how to mix? There are different ways. As I said, at times qualitative data collection can precede before the quantitative information. But there is a concurrent mixed method in which we do both qualitative data collection and quantitative data collection, and then we try to compare and also correlate the information. So qualitative data adds to the strengths of quantitative data as well. So this is called concurrent mixed methods, right? Where both are done simultaneously. There is another method which is called sequential mixed method. So if you look at this example I was giving earlier, where qualitative data collection, qualitative research method precedes before the quantitative ones. Once qualitative data collection is taken place, that helps in terms of developing the research tool, that helps in terms of understanding the population and thereby sample size collection, and helps in terms of building the relations with the respondents, so that we are able to get the required information which would help us in terms of developing the robust program after analyzing the results. Then there is a transformative mix method. Now, transformative mix method is where you use quantitative data for pre-testing the data and getting the result, and qualitative information is gathered while the intervention is getting carried out. So over a period of time, when you uh, measure the outcomes or you measure the outputs of that intervention, we have both the information available with us, that is quantitative and qualitative, right? But first, in this method, what we do is we do quantitative data collection first. Mostly, if you look at the CAP studies, knowledge, attitude, practices studies, which would lead into some kind of intervention or quasi experimental designs, they utilize transformative mix method research. And this helps us basically in a sequence to interpret the data. So transformative mix method has its own values, its own importance, and also its demerits. Now, mixing where in research is in process. Now, throughout the process of research, first we know data collection is taken, then data analysis carried out, and based on that data, interpretation of information is conducted. So, in terms of quantitative and qualitative data, we conduct both activities in the same manner that we plan the intervention, we collect data, data is analyzed, and then the information is interpreted. But it is very important for us to understand that both qualitative and quantitative data are complementary in nature, right? Like in the construction of a building, how the metal, cement, and sand is mixed together to make the building strong. Likewise, the mixing takes place in both quantitative and qualitative information so that the robustness of research takes place. This is an example of a need assessment using comprehensive participatory planning and evaluation model to develop nutrition and physical activity intervention in a rural community in Mississippi Delta. Now, if you look at this, what they are trying to do is this place is in USA and they are trying to look at the low income region having high poverty, low education, food insecurity. Now, what methods would they take to start the study? First of all, to understand the typography of the place, key informant interviews with the experts or so called gatekeepers of that place, then food store survey, that is quantitative in nature. Once you know your respondents well, you are able to develop focus group discussion tools. Community resources assessments are carried out to uh, enrich the data. Now, in terms of results, what you get, the data which is qualitative in nature, in terms of the uh, uh, different characteristics, the different complexities in the place, what kind of challenges there would be, and mostly the questions around how and whys. Then, when you have FGDs, focus group discussion, we will talk it in detail what FGDs are. When you do FGDs, it helps us in terms of the shared concerns of the respondents who have a homogeneity, who have similar characteristics, but we can go in little more detail by sharing of those concerns. And all these methodologies have their own merits and demerits. Store surveys and resource mapping is done to get more quantitative information. Now, to further talk about it, this is a model which is called precede proceed model, right? And this is a model which provides us a very comprehensive view of any study. Now, what is this model? If you look at it, there are 9 phases of this model, which talks about carrying out social diagnosis in phase one. In phase two, we talk about epidemiological diagnosis. Phase 3, behavioral and environmental diagnosis. Phase 4, educational and organizational diagnosis. And phase 5, administrative and policy diagnosis. So, if we talk about precede, what it talks about is policy, regulation, organization, construct in education, environmental development. Now, why we need these 5 phases? If you look at, it talks about the details which would affect, let's say, any health condition, whether it is non communicable diseases, mental health problems. Unless and until we have these information in place, we cannot develop any intervention which we would want to have. I'll take you to some of these study designs as well, which we generally use in research. But let's talk about phase one, social diagnosis. So, unless and until we understand the population in which we would want to work, what kind of myths, misconceptions, what kind of knowledge, attitude, practices they may have, what kind of um, other aspects such as stigmas, discrimination related to that particular cause, unless and until we do not have that information, we cannot proceed further. Then the issue is of epidemiological diagnosis. Now, what is epidemiological diagnosis here? We're talking about the frequency of that particular infection, condition, or disease in a population in a given point in time. Let's say we are talking about uh, something like coronavirus, right? Now we understand that in the third phase of or third wave of COVID 19, things have completely changed. Now there would be sporadic epidemic in certain places where suddenly cases would go up, but we may not be able to see the kind of waves which we have seen in wave one, wave two, because already the vaccinations have been provided to a large section of society. So epidemiological diagnosis helps us in terms of identifying the level of infection, incidence and prevalence, which is very important for people who work in the field of, let's say, health psychology, public health, or medical sciences. And third, very important one is behavioral and environmental diagnosis. We have seen this in this COVID pandemic, that how simple, very simple behavior of having COVID appropriate behavior, what we call wearing a clean mask, having a social distance of roughly about 2 meter physical distance, and hand washing, very simple, doable behavioral patterns were not followed by people when the element of threat or fear had gone. Of course, the use of all these uh, three things, that is, COVID appropriate behavior, got increased during the first wave and second wave when it was almost at the peak. But then gradually it has got siphoned off. And now, if you see, people are not even adhering to these protocols. And same what we have seen in case of vaccination also. So behavioral information or the environment I am talking about, environment is not the climate basically, but the environment is in which we are living right now, right? So that environment we are talking. So understanding the environment would mean what kind of legal processes are there, what kind of other structural issues are there. Let's say if somebody is in need of some medical help or social support, what kind of support would be provided, what role people may have in different levels. Let's say the kind of support we gained from the first line service providers such as health workers in case of COVID-19 pandemic, so as the police and various other policy implementers who helped in terms of having the social blockade, that would mean the movement of people around. So phase 3 is very important for any intervention. The diagnosis would help us in terms of getting the knowledge, the information of the ground. Fourth is organizational and educational diagnosis. Now, as we know, education and resources are very key to deliver any kind of services in place. So, unless and until we do have the um, you can say the means of providing the intervention, we won't be able to kind of get the success. So, educational and organizational diagnosis helps us to see where we are. We understand that education helps in terms of modulating the behavioral change. So with high amount of education level would mean that we have better chances of behavioral change taking place. So education plays a major role. Administrative and policy diagnosis. Now, why administrative and policy diagnosis? Because ultimately we have to roll out any intervention. Without the support of administration, policymakers, we cannot scale it up to a level, right? And if we have a scale of, let's say, a country like India, which has so much of diversity, so much of, you can say, regional differences, the challenges are immense. But what we have seen in last 2 years, that in a pandemic, which is as dangerous as, you can say, communicable disease, the country is quite strong in case the policymakers and administrative staff put together their resources, their thinking together. So that's what. So having these diagnoses in the 5 phases is very critical for having any kind of intervention, whether it is social intervention, health related intervention, public health related intervention, etc. In terms of implementation, now it comes the sixth phase, whereby we are intervening with the community, implementing the so-called services which we would want to offer to bring that change. So implementation of activities in, this could be in of course in different levels, steps, phases, etc. Once the intervention is implemented, we need to measure, we need to monitor the processes of that intervention. So process evaluation. And once the intervention is implemented for a period of, let's say, 2 years or 3 years or 5 years, then we have a better chance of looking at how much outcome or how much impact that intervention has made. Let's say today, if we are implementing a scheme, how that scheme has resulted in to some kind of outcome after, let's say, a few years. There are a number of schemes which are offered as part of whether the government program, or let's say if there are some schemes which comes in private setting. But looking at health or health promotion example, right? How these different first 5 phases help us. They help us in having a data achieved through mixed method research design to plan a robust implementation strategy, a strategy which would further broken down in terms of objectives and activities, etc. So phase 6 is basically which talks about the implementation of program, helps us in terms of deciding what we are going to use as inputs, as processes, as outcomes, what we expect as outcomes, what would be the outputs and outcomes, and thereby impact of the intervention. So if we look at the example of health promotion, let's take example of COVID-19 itself, right? So we understand that health education, by using different channels of communication, whether mass media, middle media, or local media, such as social networking sites and different platforms, how they have helped in terms of having a good amount of awareness and knowledge level among people. And likewise, policies and regulation organizations, without the support of policymakers, administrators, regulation organizations, we cannot achieve it. And we have seen this in example, the Ministry of Health and Family Welfare, the disaster management authorities, not only at national level, but at the state level, how they worked together and provided the kind of information which was needed at the grassroots level even, and how it has helped people in terms of overcoming their conditions and fears from COVID-19 pandemic. So if you look at the arrows, It says that both health education and policy regulation organizations help in terms of addressing the predisposing factors such as the knowledge level related to COVID 19, the skills which are required to deal with COVID 19, the kind of misconceptions people had related to it. So, addressing all of it through a robust health education program by using different channels. And likewise, the policy regulations helped in terms of enabling factors, regular regularly having press conferences by Ministry of Health and Family Welfare, likewise the stimulus which was provided by the Finance Ministry, and many more steps which were taken by the research organizations in terms of getting the robust data helped in terms of addressing the issues. So it would lead, enabling factors, enforcing factors would lead to address the predisposing factors of COVID 19, for example. And then it would help in terms of behavior and lifestyle changes. It helps in terms of changing the environment, and we have seen this very live in last 2 years. Of course, it had an impact on the education system, it had an impact on the learning cycle of our students and our colleagues. But yes, we were able to get the desired levels of protection against COVID 19 infection. And we as a society has rebounded. We have responded, we have become more resilient towards pandemic like COVID 19 put together, and thereby improving the quality of life. So this proceed model, so proceed is phase 1 to phase 5 is proceed, right, where we are carrying out assessments based on the mixed method research designs, both qualitative and quantitative research design. And then you proceed in terms of policies, regulations, organization of resources, constructing the educational inputs which you have to provide, creating an enabling environment where behavioral changes take place. And when I'm saying this, I'm telling you this by looking at the data which showed that wearing of mask by people had gone up to as high as 85% when we were in the peak of pandemic. The social distancing, however, got impacted because of the lockdowns. But anyway, lockdowns helped in terms of containing the pandemic so that it has not affected so many people in one go by putting pressure on resources. It has helped us in terms of taking the systematic changes to provide vaccines to so many people. Roughly 75% of India's adult population has got vaccinated based on the data. This model, whereby we do the um, needs assessment, as in what kind of the needs community may have, assessing those needs, and thereby developing the intervention. So we use methods, mixed methods, to carry out it. So what we do in needs assessment in phase one, let's say prior health problems. What kind of prior health problems people may had or have, right? Ranking them, conducting the FGDs within them. In phase three, behavioral and environmental risk factors. Again, carrying out FGDs and questionnaire surveys together so that we are able to get the qualitative and quantitative data. Then educational diagnosis, carrying out using the FGDs and questionnaire survey to get the information where we are in terms of health education or otherwise the education levels of people on that particular issue. Resources, what kind of resources are available? So for that we may not have to go for FGD, but we can have key informant interviews, talking to the people in the Ministry of Health and Family Welfare, talking to the larger set of decision makers, such as, let's say, vice chancellors of universities, that what kind of impact there would be if there is a lockdown, whether the universities would be able to move on e resources, whether they would be able to utilize um, the e platforms to carrying out their education, training, etc. So likewise, so what we do in these FGDs, based on the data which we receive, or before that, we try to identify selection of representative persons, people who can be the respondents to those qualitative research tools. What we look at, the characteristics, like when we decide the sampling, we look for the characteristics which are homogeneous in nature, so that we are able to kind of get the picture of that particular population. So selection of representative population, generating a list of health concerns, concerns which are expressed by the respondents, concerns means the target audience, concerns that are reflected by the experts, ranking the list of these concerns and then prioritizing them, adding scores to each such concern, because then it is easier for us to rank them. It could be top down, right? Prioritizing first five, first 10 concerns expressed by the respondents and the key informants, identification of priority health concern. So, what kind of health concern we do think that exists among the target audience, and prioritizing those. We'll talk about focus group discussion. I think we have still some time. So, focus group discussion. Uh, Basically, this is an example that we try to look at the homogeneous population, right? Who can be part of those focus group discussion. We develop topic guides, and then these topic guides are used to collect data. The data collection is recorded by a tape recorder or a video recording, or maybe recording by paper pencil, etc. These are basically techniques which you would be learning subsequently, I'm sure, but I'll talk about some of them. Purposive selection in case of key informants interview, because you would like to get those people on hold who are policymaker, decision maker, or maybe experts in that area. So key informants interviews are carried out. For example, leaders from health education department are identified, and then interviews are taken place based on the topic guides. Then there are cross-sectional surveys. In quantitative studies, we use data such as demographic in nature. We talk about chronic diseases, risk factors, behavior, lifestyle. Then there could be various other things like health-seeking behavior, which facility or preference of facilities, and many more, depending on the research questions what we have. Most importantly, data triangulation is the key. Triangulation of both qualitative and quantitative data, triangulation of other researches or other data which have been carried out, maybe in the similar population or same population, right? Why we do data triangulation? To improve confidence of the findings from the study. So this is quite critical for us. In terms of data source, we look at the existing data sources. So, where are these data sources with regard to health psychology or public health? These all exist as the large population based surveys, such as NFHS, National Family Health Survey, such as DLHS, District Level Household Survey, such as NSSO surveys, such as even the census provides a lot of data. Now the census round is being carried out because we are sitting in year 2022, and every 10 years census is repeated. So because of COVID pandemic, this got little delayed, but now data collection is taking place. So methodology which is used, again, quantitative and qualitative data to triangulate information. There are frameworks which are used for qualitative data analysis. Just like the quantitative data, the data in qualitative in nature is also analyzed. I'll mention it to you. What does this mean? The difference between quantitative and qualitative data, as many of you would know, in terms of measurement, the intent, the very intent of measuring the information. So, quantitative research is based on measurement of quantity or amount, right? So, we express it in terms of percentages, rates, ratios. It applies to the variables that can be measured. And generally, we try to measure questions like what, how much, etc. Whereas qualitative research applies to qualitative phenomena such as why, what are the opinion, hows, tries to find out reasons of particular behavior or event. Let's say, for example, if we say that the maternal death is has got reduced in a particular place in given point in time, so what are the reasons of the reduction of those maternal death? What structural changes or what kind of changes have incorporated in last many years? Let's say this very campaign of government of Haryana, beti padhao beti bachao, right? If you look at the success of it, so it the qualitative information would try to see the reasons why people have taken up the campaign related to Beti Padhao, Beti Bachao, and how it has impacted in terms of the sex ratio, which is improving a lot in the state of Haryana. And in the country at large, it has improved immensely. So you would be wondering, many of you would be wondering that the researches which are conducted in the universities, educational setup, what kind of researches are these? Are these important? Are these good enough to provide us more information? So if you look at the types of researches, we can look at the length and breadth of these researches by looking at upstream researches to downstream researches. And there are strengths and weaknesses of each type of these researches, from basic research to operational research. Now, basic research is what we see are carried out to understand something like prevalence, incidence of a particular disease or infection or a condition, or it would tell us which variable is little more stronger, right? Or maybe statistically significant, which can be utilized in terms of developing some kind of intervention. But the range of it would further go up in terms of strategic research when you try to talk about that particular variable, how that is effective while we are having an intervention. Let's say, for example, if your research intent is to see what would work in terms of improving the physical activity of a particular individual or maybe community or a population, then you try to look at the evidences from basic researches and those variables which you found statistically significant in those researches, you try to utilize to develop strategic research or applied research. Now, applied research or implementational research, or the next extension of it is operational research, helps us in terms of developing intervention, rolling the intervention out, and scaling up the intervention. So, basic researches are those researches which are generally carried out in the academic circles, right? So, if you ask me whether these are good enough to develop interventions, I would say these could be the starting point by looking at the precede proceed model. So, this could be starting point, but ultimately, what we need is whether that intervention would work in a given situation or not. And for that, we have to have um, interventions planned based on strategic, applied aspects, and operational aspects. Let's say this example, right? Uh, Maybe some of you would be able to relate with this. So, if the example of research is on malaria prevention in children, now you may not be working in the field of public health or health psychology, But one can relate with this because all of us can be affected by malaria, right? You can change malaria with dengue or chikungunya. I know this is something which we have seen in the community as such. So basic research would look into something called what are the fundamental nature or phenomena of particular causes related to malaria. So question would be identifying the socio-economic factors which reinforce behaviors that contribute to malaria infection among children. And further, if we look at in terms of strategic research, it would talk about describing the ways of reducing child exposure to mosquitoes. Because we see there is a shift from identification of variable to what kind of practices which would be useful in terms of protecting the children from mosquito bites. One way of looking at is how we can contain mosquitoes. Other is if at all there are mosquitoes, how we can ensure that these mosquitoes do not breed and do not bite the children so that the malaria can be prevented or contained or controlled in that particular area. Develop insecticides treated bed net. Again, further level of strategy that we can have an intervention whereby a treated bed net is used, that how effective a bed net which is treated by chemicals can prevent mosquitoes entering into the bed nets. Conducting clinical trials of bed nets in controlled setting and carrying out trials of bed nets in the community. So look at the levels of different researches which would move from basic research to applied research, and then look at the how these bed nets can be socially marketed so that people are able to are in behavior, or they are enabled to purchase these bed nets from local market, or maybe they are able to get it from some specific organization identified to run the social marketing of those bed nets, and there could be various other products as well. Finally, in terms of operational research, what we try to look at is determining the impact of that particular intervention over a period of time. There could be various other angles also, like how financially viable, economically viable that particular intervention, such as treated bed nets, could be, or let's say mosquito repellents. Different products are available, how best these function while in the field. Of course, in the lab setting they may provide a different you can say efficiency or effectiveness, while they are in the field how much they would be affecting. Now very quickly I would try to move on, because roughly I have 10 to 12 more minutes to talk about these research, and then we'll move for question answer sessions. So, looking at the qualitative information, qualitative research, what we try to do is the information which is non quantifiable otherwise is assessed by using qualitative research methods, such as the experiences of people, feelings of people, emotions, traditions, beliefs, practices, viewpoints, perceptions. All these are very important and relevant when we plan the intervention strategies, when we plan strategic, applied, or operational researches. Without this information, we may not be able to, we may get a scale of people that what level of perception on that particular thing they may have, but ultimately what would influence those perceptions, how people would be able to reach out best with some kind of technology or information sharing can come only with the qualitative information. In qualitative research methods, 2 plus 2 is not 4 always. There could be various other aspects also which we need to identify, and that is where the qualitative research is quite important, because it is not in terms of human behavior, doesn't move in terms of mathematical reasonings. Human beings, they we have recognized that there are individual differences. We behave differently at different levels. All of us have different experiences and beliefs, and hence it is important that we have qualitative research methods in place in addition to quantitative. So qualitative research method is to supplement the quantitative data. I have mentioned this when we discussed transformative design, that we are supplementing the quantitative information. Whereas in sequential method, we have seen that before we get into the quantitative research or data collection, we try to do qualitative research method based research first, so that we have qualitative information, we understand what all needs to be captured as part of quantitative assessment. So when we do quantitative assessment, we are trying to see the scale, right? We're trying to see the numbers, whereas in the quality data collection, we are trying to see the context. Okay. Another big difference is in quantitative and qualitative data, that in quantitative data we are always aware of the variables which we are trying to measure, whereas in qualitative data we may not be aware of the variables as such, and that is where it could be exploratory research, where we are trying to look at the very variable itself, right? That what would reinforce the quantitative assessment or quantitative data further. So understand reasons, beliefs, experiences, perceptions, phenomena, etc. So non-quantifiable information is used in the form of qualitative research. We call it natural research as well. So generally there is no hypothesis to be formulated initially as part of the qualitative research. The hypothesis is developed, refined in the process of research. So basically, qualitative research helps us in terms of developing the uh, right kind of hypothesis which we use in quantitative research. The researcher is an important part of the research process itself. I would say the researcher himself is the research tool in case of qualitative research. Unless and until the researcher himself or herself has a better understanding of the topic guide, the kind of issues they're trying to capture, that qualitative research cannot be very productive. Contexts and cases taken seriously to understand the issues. So we need, so there is no sense of, you can say, either comparison, or let's say um, inferencing on larger set of population by using the context, right? So it is always used to get the contextual information, the case specific information, right? So we understand that quantitative research method includes survey, whereby we use questionnaires, we use a different interview schedule, and it could be online surveys, right? Experiments, etc. Whereas in qualitative research methods, we use observation method such as participatory, non-participatory research methods, FGDs, in-depth interviews, key informant interviews, etc. Quantitative alone is done to determine the number, percentages, prevalence, incidence, where we try to uh, basically tell that, okay, if this sample is has this information, we can always say that the entire population may also be having the similar values, whereas in qualitative we always look at a contextual information in that particular area, which may not be translated in terms of comparison across the board, but when put together along with quantitative data, it its rigor improves, right? Then it makes a little more sense to do it. So I'm just taking away some of the uh, so qualitative before quantitative, I have mentioned it. that when we are not aware of the variables itself, when we do not know what to be used as part of quantitative, it is better to do first the qualitative research method, qualitative research before quantitative research. This is quite important. Now, in terms of qualitative research method and quantitative research method, the very approach is different, right? We use inductive approach while doing the, or you can say qualitative method is based on inductive approach, whereas the quantitative research method is based on deductive approach. Now what does this mean? So inductive approach is when basically we are trying to make an inference based on a sample, right? And when we say that, okay, if this particular sample has this very let's say behavioral perspective, we can easily relate it with the rest of the population. Whereas in inductive approach, it is different. In inductive approach, we are basically looking at the inference based on the widely accepted facts and premises. So qualitative research method is done. This is something wrong, I would say. So qualitative research method is based on deductive approach, and quantitative is based on inductive approach. In qualitatives, we look at more words. We help in terms of hypothesis generation. We may have several realities. Subjectiveness is there. Qualitative is more process oriented rather the outcome oriented. This we have mentioned previously. In quantitative method, we talk about numbers. We talk about testing the hypothesis or verification of hypothesis, and that is where you see many researches. The quantitative researches, they start means in terms of they with objectives, and thereby they develop the hypothesis, which generally they test as part of the results analysis and interpretation discussion. In quantitative research method, we have one reality in place, right? And that we are trying to see that one reality on a sample, and then trying to relate it with the population. It remains objective, it remains away from subjectiveness, to as far as possible to do away sort of biases, so that it does not corrupt the information, right? The quantitative data is focused on the outcome oriented approach. So the kind of change we would want to see over a period of time, right? Okay, so I have roughly 2 minutes before I conclude for question and answer session. So let's look at an example, right? Now, as I mentioned, there could be multiple realities, right? Look at this bus which is stuck in a flowing river. There could be various realities, and if you ask individually all the participants who are attending this conclave, you would have different perceptions. Means you would say very different responses that may vary. But if you look at the quantitative research method, you would have one reality that is in place, that is this bus is stuck in the river, right? And you won't be able to get multiple information about it. Okay, so as I mentioned, there are different types of methods which are used in qualitative research method. One is observation, whether you would want to be participating directly as a participant observers, or maybe a non-participant observer. Important aspect is that you are able to check the subjective reporting while you conduct it. You understand the community well, cultural context well, and based on that, then your results are you can say um, provide the very improved, very robust information. The disadvantage of participant and non-participant observation is that it is time consuming. Data recording is difficult because you are not supposed to record the information in front of people, otherwise you are results would get corrupted. This is a FGD going on, whereby you can see there is a interviewer, and then there is a person who is recording the information. There is a homogeneity. The group is roughly between 6 to 7 people, a small group, homogeneous, almost of same age, boys, in a rural area, uh, and there is a FGD going on, right? And the important point in FGD is that the number has to be less, and it has to be among the homogeneous people, so that you get the right kind of perception, right kind of information which you would want to generate. Look at this FGD going on by the trainees of nursing, or maybe auxiliary nursing midwives. They are carrying out this FGD whereby girls of similar age, maybe they are talking about the reproductive health or other topic, but at least they are of same age. You do not see any mother-in-law or anybody sitting there, so that the responses of these young women would go corrupted. So that's very important. The selection of your respondents is very, very important. It's very important when you have um, uh, FGD, that you try to provide a very enabling environment, so that the respondents are able to give their views. Generally, there are 1 or 2 people who would be very active in the group, so you need to ensure that everybody in the FGD participates. I'm sure these notes would be helpful. There are advantages and disadvantages of it. Let's talk about the difficulties first. Difficulty is that you have to transcribe the entire information. There are people are who may be introvert, extrovert. They may would want to control the discussion. So as a researcher, it is up to you, that you need to use your techniques so that you are able to provide equal participation to everyone. But it is very important that you get different perspectives from different set of people, and there could be social desirability or faking which may place as part of data collection. But if you are a very experienced researcher, you can overcome some of these. But important point is that as a researcher, you should not get involved into the discussion whereby you provide some kind of spoon feeding to the respondents. But probing is very important, so that you are able to probe as much as possible till the time you say your information is saturated. So, in the qualitative research method, you try to saturate your information. Once that information is saturated, that would mean that you are not getting any new information anymore, so that you can call it a day. The good part is that in qualitative research method, you can always revise your topic guide, unlike in quantitative research method, that your questionnaire, your standardized research tool is freezed before you start conducting the research, right? But in qualitative research, you can always revise it. Means at any given point of time, you see that there is some important question which has come into play, you can always revise it, right? So that is the beauty of qualitative research. This is one interview which is happening with an opinion leader in the community, and you see the young health professional is trying to extract some important information. So when you want to go in depth of any issue, the in-depth interviews are quite useful, right? Where you are talking about something very personal, or something which is taboo, or maybe something which you think that probably would have certain challenges, as in biases, in form of that people may not be able to open up clearly. It is better that you go for in-depth interviews, and by which you are able to get the greater details of human behavior, right? And in-depth interviews are quite useful in terms of, again, getting you the deeper set of the information. Look at this in-depth interview taking place in the field somewhere. whereby young researcher is trying to get the deeper information from the respondent, right? So again, there are various ways of looking at the quality part of your interview, that you remain active listener, your tone of voice should be comfortable in a way that the respondent do not get intimidated in some ways, do not give your own opinion or disagree on something. You should not be interrupting, rather encouraging people, and likewise. Now, once you have all this data in place, right, you carry out the thematic analysis. Right now, thematic analysis is based on certain topics, which you have identified for your research. Again, this is something which has to be learned. You try to record that information by help of a recorder, by a videography, or maybe you taking notes. And ultimately, what you do is you try to transcribe the entire information in the form that you are able to later analyze that information. So to bring in objectivity to entire system, you develop codes, or maybe you use some softwares like Atlas TI to basically look at the information, and that would help you in terms of getting the analysis done very faster. Or you can do use Excel also, not like for calculations, but maybe putting the responses respondent wise to get the information done, right? So thematic analysis could be very useful in terms of looking at the objectives of your research. And then there are basically ways of looking at this data to see the complementarity of this qualitative information to the research, the quantitative research as well. As I mentioned that we have to be very careful in terms of looking at the data which should not get lost while we are doing the analysis. So analysis part is very important. You can do it manually by developing a chart, or you can use some kind of software to develop to get the information. So this is another way, means of doing it. Means it depends on, again, the expertise of a person. Software is used basically to carry out the activity in much more you can say unbiased way, and to make it little more fast, because it is easier to sort of get the data uh, once it is transcribed, to put in the software and getting the information out of it. Now we will quickly move to the discussion. We have roughly about 10 minutes, my sense is. So I'll just stop sharing this presentation, and wherever do you think you have any question, please feel free to have a discussion on that. So I'll just try
Moving
to stop the sharing of presentation. Can somebody confirm if stop sharing has taken place?
Yes, sir, it is done.
Okay, okay, great. Because in my screen it is still showing as if I have not stopped it, because it is taking time. So, any comments or questions which have come? Anubhav, I'm
Yes, sir. Sir, there is a question in the comments pad that what is the difference between research methodology and research technique? Dear audience, please wait a moment.
Okay, I think there is a problem within internet with Dr. Uh, with Dr. Rajesh Nayarji, and because of that, I believe that he is disconnected. However, a wonderful session was taken place, and the richness of the session and the information what we have received is definitely unparallelable. And I believe that the participants must have taken the advantages and they have learned that how the research can be done in the various with the various parameter and aspect. With that, thank you very much, Dr. Rajesh ji. We've definitely indebted with your informative session. Uh, the next session, when it will be the next session, Mr. Abhinav? No, you are not unmuted. Please unmuted yourself.
So the next session is at 11:45.
Okay, wonderful. So everybody, thank you very much for joining. Let us have a quick break for the tea, and then we will be coming back as a fresh, and we will be having another session. We will be having one more fantastic session after the lunch that will be starting from 13:30. So till then, goodbye, and let us join again at
Thank
11:45.
you.
Thank you very much.
Thank you.